Fundamentally, Care Together is about bringing people together to be able to solve their care needs at the community level. We've been on a journey with Australian communities as the issue of getting care to regional and remote areas has got harder and harder. It's both a sort of tyranny of distance problem, but also the cost of delivering care and availability of workforce often makes this really hard for communities.
It is about improving the quality and safety of care and creating better jobs, decent, well-paid jobs for workers.
The Care Together program is Australia's first co-op development program for the care sectors.
We had two objectives with Care Together. One was around innovation and developing new co-ops, but we also had an objective which was about educating people about the cooperative model and looking to converting from their existing structure to a cooperative model.
What's been really exciting in Care Together is the variety of cooperatives that are forming and expanding. We've got existing cooperatives like Giradala in Bowen in Queensland, which wants to expand its service delivery, reach more of the community and grow. We've got a group of workers in Bega and Eurobodalla that we're bringing together to help them to be able to operate as NDIS and aged care workers in the new home support environment. And in Murrumbidgee, we're bringing businesses together.
These are communities that are not getting the care that they need and deserve, and cooperatives are one way of doing that.
The future of the co-op is that we can have something to help all small aged care facilities to outsource different resources to make everyone's life easier and to make sure that we're still there in the future to come.
So we're talking about HR, we're talking about financial reporting and compliance. Everyone's doing the same reporting, but that's what someone sitting in the co-op could be doing for all of us, and it'll free up the time that they can then spend on focusing on the quality of care of the residents.
These are aged care residential homes that want to support each other. They want to keep trading successfully, and they want to be able to share back-end services that they need to operate successfully.
So if you're living in a small rural community and you can see a problem and you have the relationships in those communities to know how to fix it, a cooperative actually gives you a legal and a business model and some rules and doing something collectively that you would not be able to do alone.
What we're pioneering is doing that care services through a cooperative model, that the power, the decision making, the autonomy belongs with the members of the cooperative. We're a not-for-profit organisation, so everything invested by the members comes back to the members.
The main thing we're trying to address is to allow people to stay in wage and as they age. They have access to the services that they need and they don't feel that they need to leave to get those services.
It's hard to try and find all of the services that you need. You need a gardener, you need a cleaner, but how do you coordinate all of these? How do you find out what's in your aged care plan?
Primarily the co-op will be a caring agency within the town. That could be connecting people to services, it could be connecting people to their neighbours. Do they need help to get to an appointment? Do they need help to look after a pet? Not that we would do it, but we will make the connection to link people with who they might need to provide that help.
Workers can come together and they'll have access to training and increase their skills and keep up with their professional development.
If someone has a client or a participant in Turas Heads but they live in South Durras, it's an hour drive within the cooperative, you'd have access to say, well look, you'll live near Turas, you'll be able to service this client.
I think it's really important to have a co-op that can support and attract those specialists to come to the region.
We need innovation in business models. It's not a one-size-fits-all model. These communities want to keep the power for delivering services in aged care, disability care, primary health care that's very much informed by what their local community needs.
Co-op model is ideal for our community because it is about community. The framework that we work within allows us to be who we are as Aboriginal and Torres Strait Islander people. and more importantly, that it fosters the self-determination that we often talk about within community.
These localised, more community-driven models will allow for high quality service provision. You're going to have shared accountability, you're going to have shared ownership, you're going to have democratic control, you're going to be a lot more agile.
The benefits of setting up co-ops in the care sector, that people do it for themselves. They're engaged.
All the projects we're doing are helping respond to particular community needs and challenges in those areas. And the way that the program is supporting those communities is by providing expertise and experience of people who have been there, done that before, whether that's people with legal expertise who understand co-ops, financial expertise who understand co-ops, or people who've been involved in setting up cooperatives themselves before.
It's really important to have some experts help with it because we don't understand the legal side of it and we don't understand some of the financial side of how a cooperative runs.
I think it's a matter of not do we form the co-op, it's a must, because otherwise small facilities like this one, we're not going to survive. If we can pool our ideas, pool our resources, then there's got to be some benefits out of that.
We've got a fantastic group of cooperatives that are on their journey to sustainability. Now we're in a position to be able to share all of those resources that were developed out of that first phase of the program. This is one way that we see that we're going to be able to incubate or replicate and grow this wonderful and exciting new care cooperative economy.
I want to see structures that honour people, not wear them down. And I think the Care Together program, fostering workers to own and design and lead these cooperatives, allows for that.
We would love to hear from communities from anywhere in Australia, particularly in those regions that are remote or rural, where care services are not being delivered in the way that people want, and start to explore whether a cooperative might work. Building that local capacity enables the community to take control of their business themselves and know that they're going to be able to run it sustainably into the future.